Low blood pressure and hypertension, test your cell health. Is a blood pressure test helpful? This video questions if a low blood pressure or hypertension test is helpful, and if the results, and the assumptions made, are reliable. Plus, why measuring your cellular health in conjunction with a blood pressure test is far more accurate and helpful. Some people's normal blood pressure is regarded as low by others. That's why having naturally low blood pressure readings means you're less likely to experience any obvious symptoms, if at all. However, having very low blood pressure may also mean that your brain and other vital organs are deprived of their much-needed oxygen for optimal functioning. Low blood pressure is also a condition medically known as hypotension, and there are certain aspects and traits associated with low blood pressure, as follows. Number 1. Understanding hypertension or low blood pressure. A person is considered to have hypertension if they have a blood pressure reading of 90/60ths of a millimeter of mercury or below. A normal blood pressure reading is 120/80ths of a millimeter of mercury. If you're generally considered as being healthy, having a blood pressure reading of 90/60ths of a millimeter of mercury or below should not be a cause for concern, unless it harms your body and some symptoms are experienced. Number 2. Guess-based versus test-based. Considering yourself as being healthy, as mentioned above, is a dangerous game to play, and highlights the typical guess-based approach by the medical and alternative health professions. Here are 7 reasons why. 1. A test-based approach to determine if you're healthy at a cellular level is something to seriously consider, simply because your whole blood system, just like the rest of your body, is made up of cells. 2. The test-based approach measures if your overall health is good or not. 3. Your cellular health is the very foundation of who you are. You wouldn't build a house on foundations that aren't solid and secure, so why should you treat your own body any differently? 4. Measuring your blood pressure is fine, but do it in the knowledge that your foundational cellular health is in balance for the blood pressure reading to be relevant, meaningful, and accurate. And not guess-based. 5. The same approach applies equally if high blood pressure or hypertension is the issue. 6. This approach should also apply to interpreting other symptoms when it comes to diagnosing an individual with hypertension and hypertension. For example, an individual is usually diagnosed as hypertensive if they also experience several other symptoms such as nausea, dizziness, disorientation, and weakness, but it's still guess-based. 7. So, for your peace of mind, make sure you take the test-based option to validate or discount any guess-based suggestions. Are you finding this video interesting and helpful? If so, please feel free to give a thumbs up, leave a comment below the video, and share with people you think will find this video useful. And if you're interested in finding out more about the secrets of heart health, please subscribe, and kindly click the grey bell icon to be notified of future videos being uploaded to the Natural Health Guys channel. Number 3. Common causes of low blood pressure. The following are regarded as typical causes of low blood pressure, however, they should be looked at as triggers rather than causes. A. Pregnancy. Many women experience a significant drop in their blood pressure level during the first trimester and may reach its lowest reading in the middle of the second trimester. This occurs as a result of hormonal shifts that lead to the dilation of blood vessels. This drop in blood pressure readings is often accompanied by symptoms such as fainting, dizziness, and lightheadedness. B. After eating. Experiencing the symptoms of low blood pressure after having a meal is known as postprandial hypotension. This occurrence is more common among the elderly and those who are diagnosed with type 2 diabetes and Parkinson's disease. The intestines need a huge amount of blood during the digestion process, and if the heart rate doesn't increase to maintain blood pressure, low blood pressure can occur. C. Prescription drugs. Some medications prescribed for people with high blood pressure known as hypertension can cause low blood pressure symptoms. The same thing can also be experienced by people who are taking diuretics, erectile dysfunction drugs, beta blockers, tricyclic antidepressants, and Viagra. D. Nutritional deficiency. People who are deficient in folic acid and vitamin B12 will often be diagnosed with anemia. This condition can also cause blood pressure to drop to below normal levels. Vitamin B12 and folate are both key players in your body's red blood cell production. E. Sudden change of posture. Many people experience a drop in blood pressure when they stand up suddenly after sitting or lying down for several hours. This is called orthostatic or postural hypotension. This condition can also be caused by prolonged bed rest, excessive heat, heart problems, and diabetes. F. Heart disease. People diagnosed with a heart condition are very likely to experience low blood pressure because their heart is not 100% capable of efficiently pumping blood throughout the body. If you experience a sudden drop in your blood pressure, stop whatever it is that you're doing, sit on the nearest chair that you can grab, and drink some water. Dizziness and other symptoms will usually disappear after a couple of seconds or minutes. This is also a sign that your cellular health is very likely to be out of balance and needs to be tested as soon as possible. Summary and conclusion. Ideally, your blood pressure should be no more than 120/80ths of a millimeter of mercury and no less than 90/60ths of a millimeter of mercury. If it's lower, but not extremely so, then that's considered less dangerous to your health than having high blood pressure. However, if it's low enough to cause noticeable symptoms, it can be dangerous and should be brought to the attention of a doctor. But do bear in mind that managing your blood pressure levels is ultimately your responsibility. And that means testing if your cellular health is in or out of balance to give scientific backing to the assumptions of any blood pressure test results and conclusions. Remember, it's also your responsibility to exercise regularly, eat healthy foods such as fresh and seasonal fruit, vegetables, legumes, and lean meat. Keep alcohol intake to an absolute minimum, and sleep sensibly. So, focus on the root cause of any low blood pressure problems and not solely on the triggers that merely indicate symptoms, to get your cellular and overall health back into balance. And the root cause of any blood pressure problems is processed and ultra-processed foods, a lack of regular exercise, insufficient water hydration, and sleep deprivation. We hope you found this video, Low Blood Pressure and Hypertension, Test Your Cell Health, helpful and of interest. Please feel free to give it a thumbs up, leave a comment or pose a question, especially if you'd like to share some of your own low blood pressure experiences and tips. Below the video, and share with people you think will find the video worth watching. And if you're interested in finding out more about the secrets of heart health, become an exclusive subscriber of this channel. Just click the subscribe button in the bottom right corner of this video, and then click the grey bell icon to be notified of future videos being uploaded to the Natural Health Guys channel. You can check out other videos in this series by clicking on the end screen coming up. And finally, many thanks for watching.